Along with drug overdoses, suicides are up in the U.S., and health experts say that continues to shorten how long Americans are expected to live.
News Channel 5's Brandon Marshall spoke with prevention specialists to see if the trend is similar here in Tennessee. Brandon?
Rory, this alarming trend does affect Tennesseans and hopefully is a wake-up call that we are losing too many Americans too early to something that can be prevented.
Suicides and drug overdose deaths rose last year in the U.S. and caused American life expectancy to shorten to 78 years, something that does not surprise Ashley Burks.
It takes help. It takes seeking help and reaching out and figuring out what those underlying issues are for, causes of depression or substance abuse.
The Centers for Disease Control and Prevention said the rate of drug overdose deaths increased by 9.6% from last year, suicide by nearly 4%. Burks works at addiction campuses, takes calls from people seeking help.
You never know who you're going to talk to when you pick up that phone. It could be somebody dealing with depression. It could be somebody who's just overdosed. It could be a family member who just dropped off their son at the hospital.
She knows their pain. A few years ago, she was battling depression.
I laid on a sofa with a bottle of pills in my hand and, contemplated. Ultimately, it was a thing I was never able to go through with, and I'm very glad that I made a decision to reach out.
She says those without support should never hesitate to call.
Suicide was ranked 10th in our state with deaths. And this year it went to number 9.
Scott Ridgway says the number of women taking their lives has risen the last 3 years in Tennessee. He believes the drug overdose and suicide rates will continue to rise in the state.
I would say yes, and that's very alarming because one suicide is one suicide too many.
An alarming reality both Ridgway and Burke say needs more attention.
Now, when it comes to overdosers, first responders who administer Narcan will soon be giving patients information cards, something similar like this, detailing where to get help before another close call. If you or someone you know is dealing with suicidal thoughts or are battling addiction, you can call the number 1-800-273-TALK. In the newsroom tonight, Brandon Marshall, News Channel 5.